Welcome to my podcast. We'll talk now about Simman case, which is basically it's for any this emergency. So basically, you will be like in the emergency setup, and you will come to the patient who will be like in bed. So you will basically say that I'm doctor blah blah blah. I'm here to take care of you. Could you confirm, verify your name for me and your age, please? So the patient will tell you, either will respond to you and say, doctor, I'm not feeling well, or the patient won't respond to you at all. In that condition, you will look for a systematic approach for the observation. Also, you will send for blood sugar just to ensure that the patient is not hypoglycemic, because this is life-threatening condition. And then you're going to start with the A, B, C, D, E. So basically for the A, if the patient is responding to you, talking to you, engaging with you, it means the airway is patent, and you will move on to the next stage. If the patient is not responding, for instance, in that condition you have two options. Either patient hypoglycemic, whereby you're going to take blood for urgent blood sugar, or the patient in a state of cardiac arrest, and you need that condition to ensure that the head is tilted and chin is left, or you do the jaw thrust and stabilize the neck for the cervical, and then you move to the next step. That's for the breathing. You need to look and hear for the chest, if it's going up and down, and hear for the breathing from the nose. So put your ear closer and hear for that. Then you need to move to the circulation. So you need to check for capillary fill, check for the pulse rate, blood pressure, and temperature. If the blood pressure is low, so you need to ensure two wide bore cannula attached to each of the arms, and send for the full blood count, electrolyte, creatinine, coagulation profile, liver function test. Moving on, if, for instance, the patient has high temperature, and that condition you need to think and rule out sepsis. For the D, it's basically you need to look for the pupil, if it's reactive. As I mentioned, blood sugar as well. And of course, you're going to assess GCS and see the score for that. And with all of that being done, never to forget to keep the patient warm. So you need to cover with the blanket, and also examine if there is any rash or any bleeding point, or if there is any swelling. So basically that's in brief about Simman approach. If, for instance, the patient is responding and talking to you, so you need to say what happened. Can you just brief me, what do you feel now? And while you are talking to the patient, you need to keep your eye on the monitor. And if you spot anything that doesn't seem right, for instance, like irregular pulse, irregular fast pulse, so in that condition you will think about AF. If the patient, for instance, say, doctor, I'm having pain in my leg all of a sudden, so you need to think about, ischemia, which could be consequences of AF, or a chronic arterial disease. So in that condition, you need to inquire about history of smoking, history of intermittent claudication. Also, if the patient have thyroid problem or drinking excess tea or coffee, all of that is a risk factor for AF. If the patient, for instance, says, I feel swelling in my throat, I can't talk properly, the tongue is swollen, if you hear some wheeze, and this will just imply a life risk condition, which could be anaphylaxis. So you have to treat accordingly with, of course, adrenaline IM. So and follow the doses according to the age of the patient. Usually in the adult it's 0.5 per 1,000 international unit adrenaline. And you need to repeat it after 5 minutes if the patient does not respond. For another condition, if the patient is not responding, for instance, and you decide to do the CVR, you need firstly to ensure that there is no DNR in place if it's documented in the file, because this is very important. You can't just start CVR without double checking that DNR is not in place. Also, based on that, you need to, of course, treat accordingly, because this is emergency. This is not in the GB surgery. So by that, I just touch upon, in short, how you need to tackle such cases in the station. It's one of the mandatory station in PLAB 2. So it could be hypoglycemia, it could be DNR, it could be anaphylaxis, it could be sepsis like UTI, or post-TRRB, or it could be merely AF. So that's basically the common cases for Simman condition. Thank you.